Hi, I'm Dr. Sunil Kumar K, Lead and Senior Consultant, Aster CMI Hospital, Bangalore. Today we are going to discuss few salient features about what is called a COPD. COPD is an acronym used for Chronic Obstructive Lung Disease. Lungs are a wonderful organs. Now the main windpipe called trachea divides more than 23 times, connecting through a small tubes, getting into a small air sacs called alveoli. Now COPD is a disease where predominantly it involves the small airways and the alveoli. Now coming to definition of what is COPD, it is a heterogeneous lung condition characterized by chronic respiratory symptoms like cough, fever, breathing difficulty due to abnormalities in the airways and the air sac. Now it is going to be monitored by an objective parameter called spirometry to know what is the expiratory limitation. Now, why are we discussing about COPD? Unfortunately, there is a third most common leading cause for death. Now, to address this issue, global experts in the field of pulmonology put their mind together to form what is called GOLD, a Global Association for Lung Disease, which was formulated in 1998. The main agenda is to increase the awareness in the public and the medical domain and preventive and treatment aspects of COPD each and every year, which has been updated on a evidence-based platform. Coming back to what is the burden of the disease, last year I think probably there were more than 3 million deaths which was documented. At the same time, there is an exponential increase in the last 2-3 decades to the tune of more than 8 times that of the thing has been increased. Reasons? Maybe we have a better understanding of the disease process. At the same time, we have a better armamentarium in terms of picking up that early. Now, what are the risk factors what COPD carries? No doubt smoking is the most common cause. May not be the only one. There are others non-smoking related risk factors like secondhand smoking, air pollution, and a context like India, we have a biomass fuel, air pollution, and infection also contributing significantly for the risk factor for COPD. Now, what is pathogenesis of this particular disease? It's basically a lung inflammation because of some noxious stimuli, either smoke or non-smoke etiology. This chronic amount of lung inflammation will trigger a lot of imbalance in terms of protein and anti-protein mechanism what is there in the lungs, which will predispose somebody go for a irreversible damage in the small tubes and the alveoli, forming into a hyperinflammatory lung fields causing emphysema and the irreversible damage of COPD. Now, most common features what we see, most commonly in the elderly population with fever, cough, breathing difficulty, and at the same time smoking history predisposed for somebody to draw a diagnosis of a COPD. I think till now we are able to summarize what is the clinical features, burden of disease, what is GOLD, what is its contribution in terms of enriching the literature on the COPD. In the second part, we'll go to more objective parameters like starting with the spirometry, management goals, and the theme of GOLD 2023 for COPD.